Our next guest has been here before, of course, talking about the innovative ways that he treats pain without surgery, and we love the sound of that. We welcome back Dr. Rudy Gari from Florida Pain Relief Group, who is here with another method, and that is called, it's got a funny name, but I'll try it right here, Kyphoplasty.
Yes.
Okay,
Yes.
So what is a kyphoplasty?
So a kyphoplasty, basically, it is a way that we're actually putting like a cement into your vertebral bodies. So your spinal column consists of 31 different bones called vertebral bodies. Sometimes, usually as we get older or we fall or so forth, that body can become fractured. It can have what's called compression fracture, where the body actually shrinks. And we didn't have a whole lot of methods before except to go and put all kinds of fusions and rods in there to straighten it up. Now what we can do, we can actually put medication like a cement into that vertebral body to make it stronger, to try to really strengthen that bone, and the relief can be sometimes instantly.
That's fantastic. Now, we're talking about, you're mentioning these vertebral bodies. It's basically the vertebrae, right?
It's the vertebrae,
okay.
Correct.
And so we're talking about back pain in any part of the back that this kyphoplasty helps?
Well, this helps for patients that have had a fracture.
Okay.
Specifically? Specifically. They've broken their backbone, if you will, somehow. And it's a way to be able to give them strength of that vertebrae again, so that they can get back on their feet and be able to get things done.
And a lot of times people who have had these fractures, they start to shrink, don't they? So does this prevent that from happening? Well,
actually, what happens when we shrink, well, first of all, it does align you a little bit more. But the reason why we shrink when we get older is not so much the bone, but there is actually this little gelatinous tissue in between the bones.
That disappears.
And that tends to get lower and lower. So we can lose 1, 2, or 3 inches as we get older because it tends to dry out.
Yeah, I've lost an inch already. I used to be 6'3", I'm 6'2" now, and I hate that. All right, so are we talking about permanent or temporary relief with this kyphoplasty?
Well, the kyphoplasty, you know, it's a permanent thing. I mean, we put that in there, and that vertebrae is a lot stronger than what it's been before.
That's great.
And that stays in there.
Sure. Now, how does one know if they're a candidate for this type of treatment?
Well, usually you know, most physicians know about this procedure. So if you'll go to your primary care doctor or your orthopedic or whoever it may be, you know, they'll diagnose that fracture and find a physician that is competent and skilled at performing these procedures. Yeah.
Now, you know, doctor, a lot of people out there who are in pain, no matter what kind of pain it is, the first thing they reach for in the medicine cabinet is an anti-inflammatory, or worse yet, even an opiate. Why is that not a good idea?
They have side effects.
Yeah.
Those anti-inflammatories, I've actually, I did a year of internal medicine, and I've seen patients actually bleed out and die from anti-inflammatories. You cannot be taking this, and you should not be taking these on a daily basis.
Yes.
There's a lot of, you know, more mild and gentle anti-inflammatory drugs, but even they have side effects as well. They can affect your kidneys. There's all kinds of different side effects from long-term medications, and of course the opioid, we all know about the opioid addiction, the epidemic that goes on. They're not meant to be taken in the long term. Some patients need long-term opioids. Right. However, there's a lot of things that can be done so that you don't have to take all these medications with significant side effects.
Okay, and this being one of them, and you have so many other treatments available.
Yes, we do.
Dr. Gari, thanks so much. Now, Florida Pain Relief Group even schedules same-day appointments for you. Be sure to visit their website, floridapainreliefgroup.com, or give them a call, 844-KICK-PAIN. And we'll be right back with more daytime right after this. Always